Caroline Hennon is a mom to 5 kids. They range in age from 9 years to just over 6 months old. For her first 4 pregnancies, Caroline had an OBGYN.
And then our fifth, when we found out we were pregnant, I always liked the idea of a midwife.
At that time, Avera Marshall wasn't offering midwifery services, but that changed in July of last year.
And about my 20-week appointment, one of the OB nurses had told me that we were getting a midwife here in Marshall. And I was super excited, and I was like, when does she start? And they had told me she started in July. And so I went out after my appointment and booked the first available appointment with Amanda. And so I saw the midwife, Amanda, at about my 30-week appointment.
She met with Amanda St. Aubin, who is a certified nurse midwife at Avera Marshall.
Midwives who work in clinics and hospitals are typically certified nurse midwives, so we have a nursing background, similar to like a nurse practitioner. So it's an advanced practice nurse. So we try to focus on low risk or moderate risk pregnancies, women's health, and we don't do surgeries. So we don't do C-sections, we don't do GYN surgeries, which an OBGYN is also a surgeon.
She was wonderful. She made me feel comfortable. She gave me a lot of different, tips and tricks with what my pregnancy was going to look like with a midwife versus an OB, and it was all really great experience.
Together, they talked through different options of what her labor and delivery could look like.
We talked a lot about things to do to cope with that, whether it's positioning or using tubs, using the nitrous oxide that we have available, or an epidural. And sometimes something works for a while, and then sometimes it stops working and you move on to the next one.
It was, right away at my very first appointment, we were talking about, hey, what is your ideal delivery? What is it you want to do? What is it you don't want to do? And then she was the one that gave me those options in my prenatal visits, and so then when I got up to the labor and delivery floor, I had to actually ask them. But I had said, hey, can I have the bouncing ball, or can I have the peanut, or can I hang out in the bathtub for a little bit?
Additionally, midwives and physicians do work closely together.
We collaborate very well, so we work as a team and we share call. So even if you choose to see a midwife, you may still see an OBGYN. Even if you choose to see an OBGYN, you still may see a midwife during your care because we do work collaboratively.
So when deciding between an OB or a midwife, that is entirely your decision. But know that either way, your health is top of mind.
I felt like, the OB experiences that I've had with my previous 4 were all absolutely wonderful. I felt safe with all the midwife as well as the OB. I didn't ever feel like one was going to get me a healthy baby and one wasn't by any means. But I felt like the experience with both of them was wonderful.
Overall, Caroline felt like she had the support she needed throughout her pregnancy and is now enjoying their newest addition to the family.
She is so smiley. She is just the happiest little baby. She's loved and doted on by her older 4 siblings. She's a great addition.